Thank you, Nikki. The big takeaway from this chart is that we continue to set new records each week and continue to increase in the number of patients in the hospital, number of patients in the ICU, and number of patients using a ventilator. In particular, you can see we had a new record of 604 daily average census of COVID-19 inpatient hospital patients. We had 169 this last week, which is well north of our previous record of 116 daily average census of patients in the ICU. And our ventilator use is at the highest level we've seen so far as well, up from our peak of 60 patients to a daily average census of 98 in the previous week. The big takeaway from this chart is the numbers continue to increase. They continue to increase at an alarmingly fast rate, and we do not see a peak in sight. Thank you, Nikki, for sharing that chart. Crisis standards of care remain in effect for Panhandle and North Central health districts. This is a result of a surge in COVID-19 patients with an already existing staffing shortage. And I wanted to take a second to clear up that the staff shortage is not a result of vaccine requirements at some hospitals. None of the hospitals in North Idaho have a vaccine requirement. Here in the Treasure Valley, St. Luke's is reporting that they currently have the highest number of employees in their history. The staffing shortage in Idaho has been long-standing. What has changed is a massive increase in COVID-19 patients needing hospital care. Hospitalizations in Southwest, Central, and South Central health districts, which includes the Treasure Valley and the Magic Valley, are reaching a critical point. Without a change in direction, crisis standards of care are imminent for all three of those health districts. Just to be clear, crisis standards of care affect all of us, not just COVID patients. There are already many patients who have had to delay surgeries or other treatments, and during crisis standards of care, tough decisions are made about how to allocate scarce medical resources. So for all of us, be a little more careful in general and reconsider activities that could land you in the hospital. The answer remains the same: choose to get vaccinated. For all of us, we also need to wear a mask indoors and in crowded outdoor spaces. And in fact, we'll show our usual vaccinated versus unvaccinated chart. Thank you, Nikki. And by the way, these numbers are now available on our COVID dashboard. If you go to the COVID dashboard and click on the statewide demographics tab and scroll to the bottom, you can see these numbers, and they'll be updated weekly. This data is from May 15th, when everyone became eligible for vaccine through last Saturday, September 11th. And you can see here that the numbers remain the same. About 90% of cases are from unvaccinated individuals. 91% of hospitalizations are for those that have been unvaccinated, and 88% of deaths have been from unvaccinated individuals. The takeaway is that vaccines work. They're safe and effective. For those of you that have been vaccinated, we say thank you. And for those of you that have not yet chosen to get vaccinated, we urge you to consider doing so. And for all of us, please wear a mask indoors and in crowded outdoor places. And with that, I will hand it over to Dr. Turner.
Thank you, Director Jeppesen. Just a quick sound check. Can I get a head nod that I'm okay? Great. So thanks. As the director mentioned, nearly all the metrics we track are trending in the wrong direction. Our 30-day daily average of new cases is nearly 900 per day, and our 14-day average is nearly 1,100, which indicates a pretty steep increasing trend over time. And while these statewide overall numbers are concerning, there are some specific trends that I think are worthwhile to sort of focus in on, and that's what we're going to do today. Nikki, will you please bring up the graph of cases? Thanks. Perfect. We are watching with increasing concern the rising number of cases in younger populations. Last week, we had 630 cases identified among teens aged 13 to 17 years of age. That represents a record in Idaho for the entire pandemic. Case rates are increasing among this particular age group at the fastest rate when we compare them to other age groups. Although the increase in case rates among children 5 to 12 are not far behind their 13 to 17-year-old peers, which are displayed on your screen here. Nikki, if you want to go ahead and switch to the other chart, that would be awesome. So we've also observed an increasing number of deaths due to COVID-19 recently. Currently, we're getting anywhere between 10 to 20 death notifications per day. And if you compare that to the number we were seeing in June, when we were getting roughly 1 to 3 per day, that puts that increase into perspective. The most concerning aspect of the increasing number of deaths being reported is that the recent COVID-19 deaths are occurring in much younger people than we saw earlier in the pandemic. So these two donut charts are basically comparing deaths during the time frame of mid-April through the second week of September during 2020 and 2021. So the same time periods in each year. And what I want you to pay attention to is that in 2020, over half the deaths in Idaho were occurring among people 80 years of age or older, represented by that beautiful lavender color on the donut on the left-hand side. Compare that to this year, where over half of the COVID-19 deaths are among Idahoans who are between the ages of 50 and 79, and that's the green color on the donut on the right. It's a much younger population losing their lives to COVID-19 this year. And furthermore, the percentage of all deaths that are occurring among all COVID deaths that are occurring among people 18 to 49 years has doubled this year compared to the same time last year. Thankfully, it's still less than 1 out of every 10 fatalities happening to younger adults in Idaho. But these are two examples of the concerning trends that we are seeing in our cases most recently. And with that, I will turn it over to Elke.
Great. Thank you, Director, and thank you, Kathy, for your words. Very sobering indeed. I want to provide a bit of an update on some of the information I shared last week with regard to what we are doing to help support hospitals and our healthcare partners and other partners. So as you recall, and the Director said, the hospitals continue to see a tremendous amount of stress, predominantly due to staffing constraints that they're experiencing. We continue to receive requests for staffing support from all across the whole state, from hospitals and clinics that are struggling with their vacancies, as well as staff out due to COVID. As I said, this is ubiquitous across the state, regardless of whether or not hospitals have vaccine requirements, just as the Director said in the very beginning of this. We and our partners at the Idaho Office of Emergency Management continue to review all of those applications that are coming into the state to allocate resources. And to date, we've deployed 20 clinical staff to Kootenai Health through the Department of Defense. We have 145 of the 504 General Services Administration contract that we hold. The clinical staff positions that have been sent out to locations across the state. 48 of the 150 Idaho National Guard non-clinical staffing support have been sent to 7 facilities across the state. And also, as mentioned last week, there are other non-clinical staffing support that we have available that we have lined up to fulfill requests for assistance through AmeriCorps volunteers, as well as the Department of Labor and other partners. So staffing support is flowing out to our healthcare partners, both clinical and non-clinical. We're also providing funding support. Hospitals, as well as freestanding primary and urgent care facilities, have been eligible for funding. We made $4 million available for hospitals and $1 million available for primary and urgent care. Funds to support hiring and retention of staff locally have shown that we have 29 hospitals that have received over $2.3 million of that $4 million. We also have 6 primary and urgent care, freestanding primary and urgent care clinics that have been awarded almost at 100% of that $1 million that we have available. Requests for the funding has exceeded the amounts that we have available, so we continue to look for additional funding and request additional funding to support more hospitals and clinics across the state. As you know, as I said last week, we were also providing logistics support to our healthcare partners. We are continuing our twice-a-week hospital information sharing, as well as our daily hospital coordination activities provide a platform for our hospitals to come together and request and receive support from one another and from the state. They're proving to be very valuable for not only the healthcare professionals as well as us to make sure that we have constant communication. For schools testing support, we mentioned last time that we made funding available to schools for testing. To date, we have 29 public and private schools and school districts that have expressed an interest in our school testing grants, and the predominant request is for testing supplies themselves. The department continues to provide technical support alongside our local public health partners. My final message is a repeat not only from last week, but a repeat from what the director just said at the beginning of this. Our message continues to be incredibly important, which is why we're repeating it over and over. We've seen, Kathy showed us, our cases continue to increase. The flow of sick people into hospitals continues to increase. It's incredibly high, and the stress on the hospitals is very real. We all are responsible for doing our part to ensure that hospitals and our healthcare system is able to be there and provide the care we expect when we walk in through their doors. We can all do these simple but important things. We can be careful, as the director said, take care of ourselves, avoid activities that create that need for us to unnecessarily visit an emergency department, avoid using the emergency department as your place to get asymptomatic COVID-19 testing for work or concerts or travel. As I said last week, there are places that you can go to find testing locations for this type of testing. One of them is the gettestedcovid19.org site, where you can find a variety of locations. You can also call the Idaho Care Line at 211 to order a free saliva-based PCR at-home test. And we are also making more of these tests available for the public. Of course, our message last time was, if you need healthcare, if you are feeling ill, you need healthcare, please be sure to seek it. And last but not least, the points that we keep reinforcing over and over again is to get vaccinated. As you saw from the director's slides, over 91% of the people that are currently in the hospital with COVID-19 are unvaccinated. Also, it's important to wear your mask indoors and in crowded outdoor locations. And with that, I'm turning it over to Dr. Hahn.
Thank you, Elke. Can you hear me okay?
Yes.
Great. Thank you. I've been asked to provide an update on the monoclonal antibody treatment centers. I'm sure you recall that the governor has committed funding for us to support the increased use of monoclonal antibodies in Idaho for treatment of COVID. And I'm pleased to report we were hopeful that it would start up yesterday, but our first center, Kootenai Health, has been partnering with Heritage Health. They were hoping to start yesterday, but the actual antibody products had a delay in shipment, so they are aiming for tomorrow. And they reported to us this morning that they already have appointments, referrals coming in from providers, and they hope to begin providing those tomorrow. A much needed resource up in Coeur d'Alene. So we're very excited about that. They believe they can treat up to 48 patients in a day. We'll see how tomorrow goes. They're going to send us a report, but we're very excited that they will be starting tomorrow to provide this very helpful treatment, which will hopefully keep patients out of the hospital. So we're very excited about that. In addition, we received a proposal yesterday from Eastern Idaho. It looks very good, and we are working on firming up plans to start treatment centers in Eastern Idaho as well. And our next step was the Treasure Valley area, but we just received news today that is impacting our hopefully by today or tomorrow, we'll have those numbers firmly in hand, and we'll know that we have enough to continue to set up new centers. But we are confident that we have enough to continue the work that's been going on in northern and eastern Idaho, in addition to the providers that are already out there doing that good work. So With that, I just wanted to mention that we are very excited about the progress that's been made in this area, and we hope that patients are aware that there are treatments available, not just at the centers I've mentioned, but there are other clinics and doctors' offices and hospitals around the state providing this treatment. Thank you. I'm not sure who's next, Nikki, so I'll turn it back over to you.
Thanks, Dr. Hahn. That's totally fine. I think I am next. We are going to now take questions from the media. Most of you know the drill, but please raise your hand in WebEx or type your question into the chat area. And when I say your name, unmute yourself and announce your name and media outlet before asking your question. And if you could also please remember to clear your hand, that does help. So today our first question is going to come from Melissa Davlin.
Thanks, Nikki. This is Melissa Davlin with Idaho Reports. I had another question, but I'm really curious, Dr. Hahn, about what you just said about monoclonal antibodies. How much of a shortage might we be talking about? And is that going to delay the opening of the Treasure Valley Center? Are there going to be some patients who might not be receiving this treatment who would otherwise need it?
Yeah, thank you, Melissa. We just got this information this morning on first. To be having to deny or reverse any of the progress that's been made. I think some other providers in the area are also increasing their efforts, and we are going to be seeing a little bit of a bump in availability for Idahoans, which we're very, very pleased with.
All right. Okay, thank you. Audrey Dutton, you're next.
They reached their ceiling of what they can take.
Where staffing has been going. So they've been very responsive to the specific types of positions that the entities are requesting. For example, whether it's ICU level staff, respiratory therapists, RNs, CNAs. So if the hospital is requesting a particular type of staff, those are typically the staff that, of course, that are being provided to those facilities. As I mentioned in the beginning, we are at 145 of the 504 positions that GSA is allocating for the state. It's a wide variety. So those are, to this point in time, they've been the allocation of these resources has been kind of on a first come, first served basis. So we do have, I can't tell you specifically where they went and exactly what type of position, but it is fulfilling the requests that are being made. And it is across the state. So I know it's a little unsatisfactory, but I don't have that information right at my fingertips. But for example, a request might come in that says, I need 6 RNs for this facility for this time frame, and that's what we're trying to fulfill. Regarding the ICU beds and the number of ICU patients, You know, as we have mentioned, we do have these daily calls with all the hospitals, these medical operation coordinating cell calls, and they are doing a lot of what they are calling load leveling, trying to make sure that they can make beds available for ICU patients. And I know that we have other staff that also participate in these calls. So I'm happy to let others join in as well. But certainly the people that are coming into the hospital are very, very sick. It's, as we keep saying, it's more people than they have capacity to take because of the staffing shortages. We're trying to fill those halls, but I think we're seeing that maybe not all of that is catching up in terms of getting beds staffed through these additional resources. But I'm going to turn it over to see if Dr. Hahn, I know you participate in those calls, if anyone else has some additional input they'd like to provide. Dr. Hahn, maybe I'll start with you.
Yeah, thank you, Elke. Like you say, I think part of that question, and I'll just address this piece, is about the ICU beds and why it seems like there's sort of maybe a stopping of as far as the number of staff bed. And I do think we're hearing more and more from the hospitals that they do not have the staff to open up more ICU beds, even if they took their med surge beds, which a lot of times they need those for their medical and surgical patients as well. But even if they could, they don't have the ICU, you know, as you know, ICU nursing and ICU medical care is very specific training needed. And I think they just don't feel like they have the ability to open more beds. We're starting to hear that more and more. So I think I'll just address that piece. Like Elke, I do not have specific information about where the GSA assigned people are going other than that they're fulfilling the hospital requests.
All right, we'll move on to the next question, which is going to come from Hayat Norimine.
Hi, Hayat Norimine from the Statesman. I know I've asked this question before. I'm going to be a bit of a thorn on your side, but with deaths rising like they are, what is the justification for not restricting large gatherings or not going back in the stages at this point? I know in the past you've said what makes the surge different is the availability of vaccines, but there's still a large portion of the population that's unvaccinated, that's vulnerable, particularly kids who can get sick and aren't eligible for vaccines. So is the department asking the governor to return to earlier stages? And if not, why not?
Thanks, Hayat. I'm going to turn that over to the director.
Thank you, Hayat, for an excellent question, as always. And please feel free to keep asking any question, including that one. We want to be as open and transparent to the public as with all the data we have. And the short answer is we continue to look at all of the options on the table. Ideally, those actions are best done at a local level and at either the mayors and the public health districts who have authority to make some of those decisions as well and are closest to those situations, as well as the school boards across the state. And so it is something we continue to keep an eye on. It's a conversation that continues about what levers are at our disposal. And we'll just end with what we always say, which is the best tool we have is for people to get vaccinated. And if you're going to be indoors, wear a mask. If you're indoors with other people, and if you're not to a crowded place, wear a mask and socially distance in both of those situations.
Okay, we'll move on to our next question from Jack Schemmel.
Hi, it's Jack Schemmel with KMVT in Twin Falls. You guys mentioned that you're helping sending staffing to hospitals around the area, and you mentioned that Magic Valley was, again, near crisis standards of care. I just wanted to know if you were sending staffing to places in the Magic Valley area, and also what worries you the most about this area at this point. We have a 40% vaccination rate in Twin Falls County and a 20% positivity rate for COVID tests, according to St. Luke's data.
Yeah, thanks, Jack. I'll let the director tag on to this as well, but as we said, I can't tell you specifically what number of staff have been sent to what location, but of course we do fulfill these requests. We do make sure that these staffing requests are really prioritized based upon what's going to maximize healthcare capacity. Of course, we are continuing to be concerned about not just the Twin Falls area, but many areas across the state. We're seeing high positivity rates. come out of hospitals across the state. We hear it every single day when they do their report outs to us. And I'll turn it over in just 1 second to the director, but I think that's a really important point that we need to be very, I guess, not careful in our words. What am I trying to say? We need to make sure that we're getting our words out there about the importance of making sure that we're all doing our parts to stem the flow into those hospitals, because there are pockets for sure where hospitals are getting stressed even more than others. Like you said, those positivity rates are a good indicator that things continue to go in the wrong direction. And Director, I'll turn that over to you. You're on mute, Director.
Thank you, Elke. I appreciate that coaching. Thank you, Jack, for the excellent question. I remain very concerned. I remain very concerned for the Treasure Valley, for the Magic Valley, for the entire state. All of our numbers, as we've said, are headed the wrong direction, including the ones you've highlighted, which is testing positivity. We've shared the case numbers and the hospitalization numbers. They're the steepest we've ever seen them. And we expect them to get worse. And so I remain very concerned, particularly as I said earlier, we are, in my view, imminent towards declaring a crisis standards of care for the Magic Valley and the Treasure Valley areas. So we've done everything we can to respond to the staffing requests and the financial needs of all hospitals, including those in the Magic Valley area. We'll continue to do that to the absolute best of our ability. The hospitals have done everything they can to manage the number of patients that they're receiving, and have gotten very creative about doing that in ways that don't compromise care, but allow for the incredible number of patients that are coming in. But the reality is without a course change, we will be entering crisis standards of care soon in those areas, and that means that scarce medical resources will have to have decisions made. And that affects all of us. And that's not a situation that we want, and I know none of the citizens of Idaho want. And so the biggest answer we have is for people to get vaccinated, to choose to get vaccinated, to wear a mask indoors, to wear a mask outdoors in crowded places, for us to all do our part, so that when we need that hospital care, that hospital care is given in a way that we're used to. And so we continue to ask the public to do their part. It's the most powerful tool we have to turn this thing around.
Thank you.
All right, thanks, Director. Our next question is going to come from Shirah Matsuzawa.
Thanks, Nikki. Director Jeppesen just mentioned, without a course change, we could be headed toward crisis standards of care soon. We've heard over the weekend that there were only 2 ICU beds here in the Treasure Valley available, and that crisis standards of care would be activated this week. Is there any truth in that? Can you talk a little bit about that?
Director?
I can't speak to just two beds available or not. I just don't know if that's an accurate number or not. I will tell you that there were very, very few ICU beds available in the Treasure Valley over the weekend. There was a large increase in the number of patients in the hospitals over the weekend, upwards of 60 new COVID patients into the hospitals, and that has further stressed the system. The way the crisis standards of care process works is that a hospital or hospitals would make a request. They're closest to what's happening in their facility. They're closest to what options they have to continue to increase capacity and deal with the situation. And so our process is that a hospital would, just like we saw with Kootenai Health up north, would make that request. I don't know for a fact when a hospital may make a request, but looking at the numbers and talking to the hospitals, I will say again, I think it is imminent for the Treasure Valley and Magic Valley areas.
All right, our next question is going to come from Ian Stevenson.
Thanks. This is Ian from the Idaho Statesman. We've been contacted by some parents who are reporting a delay in COVID testing results, which is affecting children's ability to go back to school in person. I wondered if you have any information on how much of a delay there is in receiving test results now, and how many tests have been requested and need to get done. And I also wondered if you mentioned the testing grants earlier that schools are requesting. Is there anything that can be said about how much of that money has been distributed and any other details about what's happening on the ground with those?
Yeah, thanks, Ian. I'm going to turn the answer to Dr. Ball, our lab director. And yes, we are hearing of delays in testing results coming out. Maybe Dr. Ball can explain a little bit further what's happening. And then I'll turn it over to Dr. Turner to explain more about the distribution of the school testing funding.
Great, thank you, Elke and Ian, for the question. There could be a number of factors that can impact delays in testing. I think one of the ones that we've been hearing most about recently is people that are taking advantage of using the Vault saliva-based home PCR tests. One of the most critical factors with that test is to realize that test has included with it a UPS overnight shipping container. And so it's very important that folks request overnight shipping when they're putting that sample in the mail. When they put that sample in the mail through UPS, it gets delivered overnight to the laboratory that Vault contracts with in New Jersey. And once it's received at the laboratory, the results will turn around quickly. But one of the things that we've been hearing about is that people will just put these into a regular UPS drop box. And that causes a delay in the time frame that it takes to get the test from Idaho to New Jersey to start the testing process. As far as other testing modalities, there could be a variety of reasons that could impact the testing, but I haven't heard anything specifically about a particular location. So I think where I have the most information is around the use of the Vault test and the improper shipping.
Thanks.
Yeah, so Kathy Turner here. I'll just jump onto that and say, we receive anywhere between 6,000 and 9,000 lab results every single day. So there's a lot of testing going on. And of course, when the numbers of people being tested goes up, we can anticipate a little bit of a longer wait time on the results too. So that might be part of it. With regard to the school testing, most of the schools that we have been able to contact and have indicated that they're interested in resources for school testing programs really just want test kits. They want to be able to have those test kits on hand so they can make them available to their staff and their faculty and the parents of their students. So we are working frantically here to make sure that we have available inventory now and into the future to support the schools with that testing need, which is really on-hand test kits. There's a handful of schools that want to implement robust surveillance testing programs, and we are working with them to make sure that we have a budget and we can get the money out the door to them as soon as possible. So, but for the most part, the resources being requested are for actual test kits and not necessarily funding.
All right, thank you, Dr. Turner. Our next question is going to come from Rachel Cohen. Hi, Rachel. If you're speaking, we cannot hear you. So it doesn't look like Rachel is on mute. Rachel, you might want to pop out and rejoin. We'll move on to Vinny. And Vinny, I'm not even going to try to pronounce your last name. I'll let you tell us how to pronounce that. Thanks.
No problem. It's Vinny Del Giudice, and I'm a reporter with Bloomberg News in Denver. Dr. Turner, can you discuss the situation with babies and toddlers? A few weeks back, you said that was a pressing issue. And for Director Jeppesen, why aren't people paying attention in many parts of Idaho to the advice of public health officials? It seems to be something people in other parts of the country or the world don't understand. Thank you very much.
All right, let's let Dr. Turner and the director answer this question.
0 to 4-year-olds in Idaho. And I'll turn it over to Director Jeppesen.
Thank you, Vinny, for the question. Ever going to consider. But there's also a group of folks out there who are not opposed to being vaccinated, but have questions about the side effects and safety. And for those individuals, I would encourage them to talk to their healthcare professional about those concerns and to work through what's best choice for them and their families. In addition, we do know that there's a group of folks that I think is getting smaller as more of them get vaccinated, that it's a convenience factor. And I'll give you an example. If you are an Idahoan and you're working 2 jobs to make ends meet, getting time off to go get vaccinated and potentially having some side effects that take you out of work for the next day could be pretty impactful. And so there's a convenience slash making it accessible from and their constraints. That is an important factor as well. And many employers are working hard to provide time off, et cetera, for their employees to do so to get vaccinated. So it's a wide range of factors. And again, mainly for those that have questions, I encourage them to talk to a trusted healthcare professional. And then the other message we have out there is to wear masks, both indoors and in outdoor public areas, and to socially distance. And I think that's even for myself. I do that, but it's not what I necessarily want to do. And I understand that it felt like through the summer that the pandemic was ebbing, but for this Delta variant, we were on a very good trajectory. And it's just hard to go back. It's hard to go back to wearing that mask. And so we will continue to encourage people to do so. I get it. It's not convenient, but it is the thing that will help us get out of this current spike that we're in. So thank you very much.
Thank you for having me. Thank you very much.
Okay, our next question is going to come from Kevin Richert.
Hi, this is Kevin Richert from Idaho Education News. I wanted to ask, with the continued surge in case numbers involving school-age kids, especially the 13 through 17s that you talked about earlier, but also the 5 through 12s, are you seeing hard evidence of community spread beginning in the schools and reaching into communities at large?
Dr. Turner, do you want to continue?
Yeah, thanks, Kevin. It's a great question. I think it's the other way around. What's going on in the community is impacting the schools. And that has been true during the earlier part of the pandemic, and we're seeing the same thing now.
Okay, I'm going to pop into the chat. Rachel Cohen was able to type her question into the chat. We couldn't fix her audio issues. And she asks, what is the state doing to increase vaccination rates now? Despite part of the state being in crisis standards of care, it looks like the weekly doses administered went down recently. Some health district staff that she has spoken with have mentioned that they haven't been going to events or hosting clinics at schools anymore because not enough people have been coming in comparison to the resources it takes for them to host those clinics.
That's a great question, Rachel, and I'm going to let Sarah Leeds take the question.
Thanks, Elke. So the immunization program continues to make vaccine available as widely as we can to the providers who are enrolled in as COVID vaccinators. We have funding available for providers across the state to go to those types of events, and we are seeing quite relatively low numbers, but we believe it's important to be there regardless of low numbers, and we're considering it a success when 9 or 10 people at an event like a fair, a community fair, get vaccinated. That is not something typically we would say, but right now with where we are in the pandemic, every group of people we get we are available to provide vaccine who can choose to vaccinate when it's convenient is critical.
Thanks, Sarah. Our next question is going to come from Becky Boone.
Hi there, Rebecca Boone, Associated Press. I just wanted to follow up on Audrey Dutton's excellent question, and forgive me if I somehow missed it in your response. But if hospitals are informing you that they don't currently have this additional staff to open additional ICU beds in many cases, are patients, to your knowledge, are patients that would normally be in ICU beds going without?
Rebecca, I don't believe I've heard any hospital say that a person that needs ICU care is not getting ICU care. I think hospitals are getting very creative. That's where, but stretched to the point of, crisis standards of care and contingency care. I think they might be critically close to having to make some of those decisions. They don't have the beds available. They don't have the staffing available. These are the types of decisions they're making every single day. And then, stressing about, am I making the right decision? Can I make the decision that's best for this patient? That's why it's so important that we do everything we can to stop the flow of people coming into the hospital. Like I said, unless I have other staff on the line here that know differently, I've not heard in any of these calls that anyone has not been able to give that care, because there's a lot of conversation that goes on in every single call that we have every single day about all the hospitals, all healthcare systems trying to support one another to make sure that they're able to take those patients.
Yeah, Elke.
Okay,
I was going to say, maybe I'll just add, what we do hear, though, is delays a long time getting people, like people might need to be transferred into intensive care, and it takes a while to find a placement, or they need to be moved to another hospital because that hospital doesn't have intensive care beds. And I think on the other end of things, as people start to improve, I think the hospital does everything they can to move them out of intensive care, maybe a little sooner than they would have. So there's sort of this sense of the people that get intensive care and need it, that they get it. But there are some, patient care challenges where patients aren't necessarily getting it in the same way they would have before.
Thanks, Dr. Hahn.
All right, thanks, Elke and Dr. Hahn. Our next question is going to come from Kyle Pfannenstiel.
Thanks, Nikki. This is Kyle with the Post Register in Idaho Falls. Sorry if I missed this answer earlier, but I was wondering if crisis standards of care is declared in the Treasure Valley or Magic Valley or any other region, would it be considered a statewide declaration, or would it be just in two different regions in the state, North Idaho and whatever the other region is?
Yeah, thanks, Kyle. That's definitely one of the reasons why we have a Crisis Standards of Care Activation Advisory Committee, is to help us process through that. But I'm going to ask the director to finish the response.
Thank you, Elke, and thank you, Kyle, for the excellent question. The answer is what Elke said. It will depend on the situation at the time a hospital makes a request, just like we saw in North Idaho, and will depend pretty heavily on the administrators and leaders of those hospitals from the various areas of the state to help us understand what the situation is and whether that particular region should move into crisis standards of care or not. So I could see a scenario where again, I think the numbers continue to push us this way, and we would activate crisis standards of care in another region. I could also see a scenario where it would go statewide. So it's really going to depend on the situation on that particular day when that request is made.
All right, thank you, Director. We're going to start a round of second questions here. Our next question is going to come from Shirah.
Thanks, Nikki. Right before this call, Boise Mayor McLean announced that there will be specific event protocols that include or involve masks, but not a full mask mandate. Do you believe a mask mandate in high population areas would be effective at this point, or is it better to focus on COVID event management? I guess, what is your reaction to that?
Director, do you want
to? Sure. Thank you, Shirah. And actually, as you mentioned, I became aware of that about 1 minute before this press briefing occurred. So I don't have a lot of information yet on what the mayor of Boise has issued. But we will say that in general, what we have been asking folks to do is, if you're in an indoor place in public, to wear a mask, and outdoors in crowded places. And so We know that those are effective along with social distancing and of course vaccination. And so that's the message that we continue to carry is vaccinated or unvaccinated. If you're going to be inside, you should be among other people and you can't social distance, wear a mask. And outside, if it's in a crowded space, you need to be wearing a mask as well. If you can't socially distance or physically distance, excuse me. So thank you.
Okay, next question is going to come from Kevin Richert.
This kind of follows up on that previous question. This is Kevin Richert from Idaho Ed News again. We had 35,000 people at Bronco Stadium on Friday, many of whom were not wearing masks. We'll probably have another 35,000 on Saturday. Is that safe? From a health perspective, is that safe?
Dr. Hahn, I'm going to turn that over to you as the state epidemiologist.
Sure. Yeah. I wasn't there, but my understanding was that there were going to be masks required. So I'm sorry to hear if that did not occur. We would, as the director has been saying, in an outdoor space when people are shoulder to shoulder, we think it is safest for everyone to be wearing a mask. So outdoors, as we all know, is certainly safer than an indoor setting. And I think probably a lot of people feel more comfortable in an outdoor setting and feel like it's pretty safe. But we would still say really masks should be worn in that type of setting when people are that close together, shouting, encouraging their team. So there's a lot of reason to wear a mask in that setting for everyone to wear a mask.
All right, thank you, Dr. Hahn. Our next question is going to come from Ian Stevenson.
Thanks. This is Ian Stevenson again with the Idaho Statesman. And I have another question about schools. Some school districts are not requiring students to quarantine after a positive exposure with another student or otherwise, and are also not requiring negative test results for students to return to school, but rather leaving these decisions up to parents. Given the high caseloads we're seeing across the state at the moment, is it safe for kids to be in in-person schooling without those required policies?
Great question, Ian. I will start by saying that that is not the recommendation that public health is giving to the schools. We do have protocols that we have shared with all the local public health districts that work with their schools. But I'm going to turn it over to Dr. Turner if you'd like to elaborate on that a little bit more.
Yeah, thanks, Elke. You're right. The recommendation right now is that children in school should be wearing face coverings, and that's what our recommendations are on the website. And our local public health districts are working very closely with the schools within their communities to help them, navigate some of the situations with regard to parents' wishes, school safety, and the sort of physical infrastructure of the school to make sure that whatever safety measures can be implemented are implemented. But beyond that, we of course will continue to recommend what we know is best, which is physical distancing and social distancing, and for those children who are old enough that they're vaccinated.
All right, thanks, Dr. Turner. Our next question is going to come from Audrey Dutton.
Hi, I'm curious. I reported today on the number of pregnant women with COVID-19 who've had to be hospitalized, and unfortunately, some of them have been in the ICU and had to be intubated. I'm wondering if that's something the state is tracking, that demographic, and also what the outcomes have been for those pregnancies and births.
Thanks, Audrey. I don't believe that we have the ability to track those outcomes, but I will turn it over to Dr. Turner about tracking the hospitalizations and status of pregnancy in the hospital.
Thanks, Elke. Audrey, I do monitor the pregnancy indicator of our cases. So if woman is between the ages of 15 and 44, one of the questions is whether or not she's currently pregnant. So I do sort of track data on that. I don't have it with regard to outcomes of the pregnancy or outcomes of the birth, simply because we, for case investigations, it's a snapshot in time. That being said, it's possible that if we feel like that information might be useful, we can certainly talk to our vital records unit and see if there's birth certificate information that might be able to answer those questions.
Thank you.
Okay, I'm seeing a couple of hands left up. I'm going to do a quick hand check. If there are no more questions, looks like Shirah might have one more question, and this will be our last question of the day today.
Thank you. I just really quick, I was wondering, has the Treasure Valley ever hit crisis standards of care?
They certainly have not requested a formal declaration, but I think as we hear from our hospitals, there's always these fleeting moments where they are teetering or may have to make some, decision at a single point in time, but they have not to date made a formal recommendation or request to us. And Director, is anything you'd like to add?
Yeah, and if the question was, has that ever happened in the past? The answer to that is no. And then, as Elke said, we've not had a request from a Treasure Valley hospital. And as I would say, I think that's imminent given our current direction.
All right, thanks everyone for joining us today. We are planning another media briefing, same time next Tuesday, September 21st. And I did want to make a note that there's a link to the graphics that were shared during Director Jeppeson's and Dr. Turner's opening remarks in the chat, if you'd like those. With that, everyone have a good day.